My name is Ashley Felix, and I am a Cancer Prevention Fellow at the National Cancer Institute. I earned an MPH, or a Master of Public Health, in epidemiology, and then I went on to the University of Pittsburgh, where I earned a PhD in epidemiology. We get the opportunity to drive our own research and to ask the questions that are important to us as well as to public health.
So my name is Maeve Malooly. My PhD is in translational medicine. I'm working as a postdoctoral fellow with the fellowship. There's a real sense of camaraderie between both the fellows and the staff. I love it, yes. The fellowship is amazing.
My name is Crystal Lane Coos, PhD, MPH, and I currently research oncogenic infections and associated cancers. I actually really enjoy all the different projects that I'm doing and how diverse they are.
I'm Kristen Litzelman. I got my PhD in population health sciences. I am currently a second-year cancer prevention fellow. It has given me fantastic connections with people that I am really excited to keep working with.
My name is Stephanie Fowler. I'm a cancer prevention fellow with the National Cancer Institute. I work in the Division of Cancer Control and Population Sciences within the Health Behaviors Research branch. My degrees are a PhD in experimental psychology and a Master of Public Health. Our leadership has been able to provide the resources that we need to progress in our careers. I have very supportive colleagues and collaborators.
My name is Gary Ellison, PhD in epidemiology. I am a Cancer Prevention Fellowship Program alumnus. I'm currently acting chief of the Environmental Epidemiology branch in the Division of Cancer Control and Population Sciences at the National Cancer Institute. I had great mentorship in the program, someone who guided me in not only my research, but connected me with the right people who may be able to facilitate different areas of the research.
My name is Jocelyn Lee, PhD. I am a CPFP alumni, and I currently work in the Office of Disease Prevention in the Office of Director at the NIH. There are fellows who specialize in epidemiology, biostatistics, health communication, physical activity, and when you bring all of those different areas of science and sort of prevention research together, you get an opportunity to really influence the direction and also the impact of your research.
My name is Barry Kramer, and I'm a physician, a medical oncologist, and I'm also trained in public health, a master's degree in public health. And I am currently the director of the Division of Cancer Prevention. The Cancer Prevention Fellowship Program is housed in the Division of Cancer Prevention, and we're very proud of that because that is where we hope to train the next generation of scientists in our field. It's important to train a cadre of scientists who have a full understanding of population scientists and are asking questions that are crafted ultimately to help the full population.
Hi, my name is Dave Nelson. I'm the director of the Cancer Prevention Fellowship Program at the National Cancer Institute. In our program, the fellows have the autonomy to choose who they want to work with and what projects they want to work on, and they can also work in more than one area. We provide support for fellows for up to 4 years. For those fellows who haven't had training in epidemiology and statistics, we will support them for a 1-year master's degree in public health at an accredited university. If people already have that training, they can start right into our program. So they have at their beck and call the resources of all of the NIH. We also stress highly the leadership aspect of our program. So our program deals with both research and leadership, an opportunity for them to learn the leadership skills, teamwork that are necessary for today's scientists to be successful in their careers. Team science is certainly where things are right now, and by being in our program, fellows, for example, if they were a behavioral scientist, learn what's going on in laboratory research these days in a way that if they were just to work with another behavioral scientist in their area at another institution, they would not be exposed to it to the same levels that they can here at the National Cancer Institute.
Some of the disciplines that I've been exposed to within the Cancer Prevention Fellowship range dramatically, from applied epidemiology to environmental health science to health policy, all of these things spanning across the cancer prevention and control continuum, which then allows me to have a better perspective of my research and how it ties in along that continuum.
It really gave me the training that I didn't have currently, which was in epidemiology and biostatistics, and really apply that to the bench research that I was doing as part of my doctoral work, and as well as the research that I did in the fellowship, and really apply that to more of a larger public health area.
So I've had the opportunity to get involved in a number of different professional development training courses, which has been really fantastic. And I've also had the opportunity to work in a number of different research settings. So this has been very good in gaining exposure in different areas of, for instance, like grants management.
The experience is very well-rounded. So not only do I get research training, but I got training in effective speaking, I got training in grant writing, and also, I'm not a bench scientist, so there was some exposure to molecular prevention in the molecular prevention course. So I thought that the total experience was awesome.
Being at NCI, you have access to really large data sets. Also, being able to reach out to experts and understand more in depth about your specific questions has been a really big bonus of being a Cancer Prevention Fellow.
The goal of the Cancer Prevention Fellowship is to really tackle cancer from many different perspectives. That really summarizes the fellowship for me. It's very interdisciplinary, and they really allow you to grow under your own direction.
It gives you an opportunity to not just learn how to do research, but also figure out how to be a good leader and a good manager and a good mentor. If you're thinking about applying, definitely do it.